Hi, my name is Erika Unberhagen. I'm a counselor at Windmill Wellness Ranch. We are a treatment center for addiction and also mental illness. When somebody comes in for treatment to Windmill Wellness Ranch, what they can expect is a loving, understanding, accepting, healing environment. We're going to show them the different buildings and the different types of services that we offer so they can begin to lessen any fear or anxiety or reservations that they're experiencing. They also get to, in a very short amount of time, they have the opportunity to meet with their counseling team. So they know who they're going to be working with as they do the work to become well. And they also can expect a really positive community of their peers that are also here for the same reasons. They're here to become well. What's beautiful about our therapeutic community is they are very supporting and understanding of one another. And sometimes that's one of the largest components of healing, right? Is to hear somebody else say, hey, I understand what you're going through because I'm going through it too. Common concerns are, I think, the stereotypical idea of what therapy it really is. You know, I'm gonna lay down on a couch in some dark room and some person crawl around inside my mind and force me to answer questions I'm not ready or even able to answer. I think there's a fear of the unknown. What can I expect? What is this gonna look like if I've never been in treatment before? What's going to happen? Who are these people? Are they going to understand my unique situation? And the answer, of course, to that last one is we absolutely do. We tailor our therapies to each individual's needs. So if they come in with, let's say, an addiction disorder, then we will work with them to develop treatment goals, things that they want to accomplish while they're here. We don't sit with our notebooks and take lots and lots of notes and then, respond with, tell me more. Of course, we want you to be comfortable sharing as much as you're comfortable, but we're going to meet you where you're at. So we have what's called didactics. That's just a big fancy word for educational groups. So you're actually going to learn about addiction and co-occurring mental health disorders. That's usually one of the first steps in recovery, is to understand what's been going on with you. And so we have these groups that are specifically designed to educate the individual on what that mental health disorder looks like, what factors led up to that mental health disorder, what things has the individual been using to try to manage life with that mental health disorder. And of course that includes things like addiction. We also educate on addiction. What are the factors, the genetic factors, the environmental factors, trauma factors, life experience factors that contribute to the development of mental health disorders? There's a large stigma still out there in society with people who have addiction and mental health disorders, co-occurring disorders. And the first step in eradicating that stigma is education. So therapeutic groups that we offer, we have processing groups. There's a large amount of healing that takes place in processing groups. This is a group, these groups are specifically designed for individuals to come in and talk about the things that they're really struggling with. There's a concept that I abide by that is you have to feel it to heal from it. And we avoid not feeling, many of us, for many, many years. And we avoid those feelings with drugs or alcohol or anger and rage instead of fear and pain. The process group gives you a therapeutic environment with a professional mental health provider in the room that guides the group and ensures everyone has the opportunity to process and talk about the things that they're struggling with internally. So what I specialize in is the treatment of first responders and veterans. There are issues that are often associated with the helping professions that maybe aren't as generalizable to other populations of people. So I specialize in the treatment of these populations because of the very nature of their job. Oftentimes they have struggles that the average person may not. Things such as moral injury, trauma, grief and loss, identity. Who am I? spiritual concerns. Maybe somebody was raised with a particular spiritual or religious belief system, but because they've seen the ugliness that parts of the world offer, that they've become disenfranchised with that belief system. I'm not here to reconnect them to a system they don't want to be reconnected with, but of course if that's something that they are interested in, then I can certainly do that. I can also help the individual discover a belief system that is going to work for them in present day, that is supportive of them, supportive of their life choices, supportive of recovery, and I help them to understand how they can use that belief system to maintain one of the three legs of recovery, right? We talk about recovery being a three-pronged approach. It's mental, it's physical, and it's spiritual. I'm not here to preach the Bible. I'm not here to impress on somebody any one particular belief system. But if the individual is interested, then it's something that I can help reconnect them with. The sense of trust and community is absolutely crucial. You have to be able to trust your therapist. I've been that client, and if I didn't trust the counselor, I wasn't going to share the things that I had been holding so close to the vest, in my case for years. I needed to be able to trust the person that I was talking to. And so understanding that from a client perspective helps me as a therapist to understand the importance of not just developing that trust, but earning that trust. I don't expect somebody to walk into a session with me for the first time and open wide up. If that happens, that's wonderful, but most often that's really not the case. They, like me, are going to need to size me up and figure out whether or not I am worthy of the trust and whether or not they believe their trust is going to be validated. So for family members, addiction and mental health disorders don't just impact the individual. It impacts the family system. So, and it's not just the mental health disorders or the trauma, it can also be the communication styles. You know, law enforcement officers, people that are on deployment, that are going through villages, they're not saying please and thank you. They can't by the nature of their job, depending on the situation. And oftentimes that communication style and that manner of dealing with people in a crisis mode translates to how they communicate with their family members also. So the healing is really a two-pronged approach. It's healing the individual, but it's also helping to heal the family as well, so that the individual and the family can come back together in a healthy way. We provide family workshops which educate the family members on what their family member has been going through and why. Why does mom cry all the time? Why does dad cry all the time? These workshops are designed to educate the family members because, again, the first step to healing really is education and awareness.